Hello, my name is Dr. Jacqueline Lynch and I'm a consultant clinical psychologist. I'd like to talk today a little bit about trauma. Trauma is defined as any experience that is outside the normal expectations of life. So, for example, if you have a traffic accident, you might be a very experienced driver, somebody who's been driving for many years. But an accident occurs and that results in trauma. And that's because the accident was outside of your normal experience of driving. So, what would trauma symptoms be? Well, one of the things our brain does, which is really clever, is our brain helps to understand the traumatic event. It does this by replaying and replaying the trauma again and again. That might mean that you find you're preoccupied with the trauma, can't get it out of your mind, can't stop thinking about it. Or even more commonly, that trauma might come back in flashbacks or even in nightmares. And that's a very normal experience. It's your brain just trying to work out the trauma, trying to understand why such a thing has happened to you. Sometimes with reliving experiences comes anxiety. Anxiety is a really normal response to trauma. Anxiety is also a really normal response to reliving memories. So what type of symptoms might you think of with anxiety? Well, that might be heart palpitations, sweaty hands, maybe that funny feeling in your tummy, even having panic attacks or very regular headaches. All of those things are going to tell you that you're feeling anxiety and you're feeling more stressed, and those things are very normal. Our anxiety symptoms are just a biological way in which our body is helping us to understand that we're in danger. It harks back to the days when we used to have to run from danger, run from woolly mammoths. And then the outcome of that was that our bodies learnt how to respond. And anxiety is the leftover part of that we still experience today as human beings. Another part of trauma is avoidance. Avoidance might take the form of avoiding talking about, thinking about, or even visiting anything that reminds you of that traumatic event. It might be really hard to talk to friends or colleagues or family members and even share the experience. And that's partly because thinking about the event, again, is likely to cause deep levels of anxiety. Frequently when we experience trauma, we experience a very intense levels of emotion. That might be hurt, fear, it might be a sense of shame or even guilt. And it might even be feelings of hopelessness or helplessness. And those types of feelings are really difficult for us as human beings to have. One of the ways in which we manage that sometimes is through becoming angry or having outbreaks of rage, even having times when we become short-tempered or frustrated with people or in situations where we would normally have felt really calm. Sometimes the first people to notice that are family and friends, even more than we are. One of the things we often experience with trauma is finding it difficult to concentrate, difficult to remember things. Again, that's a very normal experience of trauma, and that's because our brain is working so hard to process the information that actually there's no capacity left in the brain for the unimportant or for shopping lists or even to remember how to drive properly. One of the key things if you're experiencing trauma is to talk about it. Talk to family, talk to friends, make sure that people know that you're going through something. Another great thing that will help you is to do some mindfulness, and there are lots of great mindfulness apps that you can find, or to be able to get some good exercise. Raising the endorphins, thinking about your trauma while you're exercising is a really good way of working through that. The most important thing is, don't be alone.